Hello, my name's Marcos Patchett, the Nocturnal Herbalist, and this video is the introduction to a series of videos about cancer, and in particular my views as a complementary therapist, my views as a medical herbalist on the role of herbal medicine in the complementary treatment of people who have been diagnosed with cancer, and possibly even the use of herbal medicine as a treatment for or in cancer, which is a very controversial subject. So the reason for me doing these videos is basically in the last sort of 5 or 6 years, I've seen a few clients with cancer, and I've been able to help a few with just reducing the side effects of some of the conventional treatment, and in 1 or 2 cases even helping people achieve a temporary, unfortunately not permanent, but temporary remission of their cancer. 1 or 2 clients who, for reasons of their own, refused conventional therapy, either on ideological grounds or on grounds of it perhaps that they were only offered palliative treatment. That means that they were diagnosed with an incurable cancer and they didn't want to go for chemotherapy. So I have some familiarity with the subject from my practice, but it's really something I want to know more about, because in a lot of cases there just isn't enough information on how herbs can be combined with conventional therapy for their use to be safe. So you have to be really careful. And in other cases it's just we don't know how effective the herbs might be in real life. So I really wanted to do this series of videos in order to really give me a reason to investigate and explore what information there is much more fully, and then share those findings with you. And the second reason is just so that hopefully what I'm able to find and share and disclose will benefit many other people. So this is a controversial area. There's lots of ethical issues about practicing as a complementary therapist in this area. There are practical or pharmacological issues, like which I've referred to. Can you combine certain herbs with certain drugs? Can you not? Is it safe? Are the herbs going to be effective? And so in addition to the ethical and pharmacological issues, there are also sort of ideological conflicts which one encounters, where you encounter prejudice both in the conventional medical establishment and on behalf of the complementary and alternative fraternity, if you like, whereby, and this can occur in both patients and practitioners, where you have patients who are, you know, and as a complementary practitioner, I see this end of things, where you have some patients who are totally and irrationally opposed to seeing a conventional doctor. Maybe they're very afraid that if they go into hospital, then that's the end. Maybe they've seen relatives with cancer die in hospital and that's affected them, or maybe they've had a bad past experience with the medical establishment. And then in that case, it's my role to try and encourage those people to see a doctor and to see an oncologist. But then equally, you've got oncologists or doctors who are so rabidly anti-complementary medicine that they will tell their patients just to never take any herbs, to not take any supplements, to ignore any advice from a complementary therapist. And then you end up in a situation where a client who might have come to me is given 2 conflicting bits of information and there's very little communication, and that is very distressing for the client. So, you know, ultimately, in that situation, you know, sometimes the doctors are right. Sometimes they're saying don't use herbs because they might interfere with this chemotherapeutic drug that you're on, and that's fair enough. But sometimes they're saying don't take any herbs whatever, and there may be good research evidence for the use of those herbs in combination with that chemotherapeutic regimen, and a very good safety profile and evidence that they're not going to conflict with the drugs in any way, and yet they still will just reflexively say no, for no good reason other than prejudice and ignorance, which is just unforgivable to me in a medical practitioner. So really, I'm hoping that this series will improve my knowledge base and just help people who have been diagnosed with cancer, and just help to inform people, and of course hopefully also be interesting. So I'll be approaching this topic from a variety of different angles, and I'll be talking about some of my clinical experiences. I mean, I can't talk about specifics because that would breach confidentiality, but I can certainly refer to different circumstances that I've encountered, both in terms of clinical successes and failures that I've had in this area, and the reasons I think things fell out as they did, and what ramifications that had for my practice, but also just in terms of what kind of things patients might encounter when they've had a cancer diagnosis. So my hope is that this series will help people, and will help me develop as a practitioner. So thank you for watching, and hopefully see you in the next video. Bye.